They call it the silent killer for a reason. Every 40 seconds, someone in the US has a heart attack, and most say they never saw it coming. No crushing chest pain, no dramatic movie scene, just a quiet feeling that something was off. And for seniors over 60, that single missed sign can mean the difference between catching it early, stuki, or not waking up the next morning. If you're over 60, what I'm about to share could save your life, or the life of someone you love. By the end of this video, you'll know the 3 silent warning signs that doctors say most seniors completely overlook. And once you recognize these signs early, studies show you can reduce your risk of a fatal heart attack by up to 80% according to the American Heart Association 2024. So if you stay with me till the end, you'll learn how your body quietly warns you days or even weeks before a heart attack. Simple steps to protect your heart without needing more meds, and one powerful 5-minute daily habit that strengthens your heart's rescue system. Ready? Let's start with what makes heart attacks so sneaky and why seniors are especially at risk. Do comment if you have any questions about this video or any questions relevant to senior wellness. I will be replying to every comment. Let's get back to the video. Now, you see, heart attacks don't happen overnight. They build up slowly, silently. Plaque, that sticky cholesterol buildup, narrows your arteries over years. Then one day, a small piece breaks loose, blocking blood flow to the heart muscle. But here's the shocking part. According to Harvard Health, over 45% of heart attacks occur without classic chest pain. Why? Because aging nerves become less sensitive. Your body's alarm system doesn't shout anymore. It whispers. That's why so many seniors never realize their heart is in distress until it's too late. But there are signs, quiet ones, hidden ones, and once you know what to look for, you'll never ignore them again. Let's get to it now. Silent sign number 1, unusual fatigue or weakness. The first silent sign isn't pain, it's fatigue. That deep, heavy tiredness that doesn't go away, even after a good night's sleep. You might think, I'm just getting older. But in many seniors, that's your heart quietly crying for help. Here's why. When arteries start clogging, your heart has to work twice as hard to pump blood through narrow passages. That robs your muscles and brain of oxygen, making you feel drained, weak, or lightheaded, even from simple tasks like carrying groceries or climbing stairs. A Mayo Clinic study found that women over 60 are 2 times more likely to experience fatigue before a heart attack than chest pain. If you feel this kind of unexplained tiredness, especially if it's new or worse than usual, don't brush it off. It might not be just age. It could be your early warning. Silent sign number 2, shortness of breath or tightness in the chest or neck. Next, watch out for subtle shortness of breath. You're not gasping, but you feel like you can't take a full breath, even while sitting or walking slowly. Doctors say this happens when your heart can't pump enough oxygen-rich blood to your lungs. It's your heart's way of saying, I'm struggling. Here's a tip. If you find yourself breathing heavier during activities that used to be easy, like talking on the phone, making the bed, or walking to the mailbox, take it seriously. And it's not always chest pain. Some seniors describe it as pressure or heaviness in the upper chest, tightness in the neck or jaw, or even a burning in the upper back or shoulders. That's your body trying to send a message, but it's speaking in whispers. So if you ever think this feels strange but not painful, that's the moment to act. It's better to get checked and be safe than to ignore a warning your heart is trying to send. Silent sign number 3, nausea, sweating, or lightheadedness. The third silent sign often gets mistaken for something else entirely, indigestion or the flu. But sudden nausea, cold sweats, or dizziness can actually signal a drop in blood flow to your brain and stomach. Classic signs of a silent heart attack in progress. For example, one senior patient described it like this. I felt a wave of nausea and started sweating, but I thought it was bad food. Hours later, doctors said I was having a heart attack. These symptoms happen because your body goes into shock mode as it struggles to circulate oxygen. Here's what you can do if this happens. Sit down immediately. Breathe slowly and note the sensation. If the nausea or dizziness persists more than 5 to 10 minutes, call emergency services right away. Remember, your heart isn't just a muscle, it's your body's power source. When it starts to fail, every organ feels it. Now for the part you can use immediately, a simple, safe routine you can do every day to strengthen your heart's resilience. This is not a gym workout. It's a gentle, 5-minute practice designed for seniors, including those with joint pain or limited mobility, and each movement has a specific job. Improve blood flow, reduce strain on the heart, and calm the nervous system so your body can repair itself. We'll do this in 3 blocks: movement to wake circulation, gentle upper body motion to move blood back to the heart, and breathing to lower stress and slow the heart rate. I'll tell you exactly how to do each part, how many counts, and how to make it easier or harder as you get stronger. First, 2 minutes of gentle walking in place. Stand or sit tall with good posture. If you're standing, feet hip width apart. Start by lifting one knee a few inches lower, then lift the other knee. March at a comfortable, steady pace, not hurried. Count in your head. 1, 2, 1, 2. If standing is hard, do this sitting in a sturdy chair. Lift your toes up, then point them down. Alternate lifting each knee slightly. Either way, keep your chest open, shoulders relaxed, and breathe normally. The goal here is to activate the calf muscles and the large muscles of your legs. Those muscles squeeze on veins like a pump and push blood back up toward the heart. Better venous return means the heart fills more efficiently and doesn't have to work as hard. Over time, daily marching improves circulation and helps lower resting blood pressure. After about 2 minutes of marching, pause and feel the warmth in your legs. That's good. If you get dizzy, sit down immediately and rest. Next, 1 minute of slow arm circles to boost circulation and upper body flow. Stand or sit with your feet planted. Extend your arms out to the sides at shoulder height. Palms can face down or slightly forward. Begin making small circles forward for 30 seconds. About 1 circle every second croak. Then reverse the circles for the final 30 seconds. Keep the movement smooth and controlled. If shoulder pain is an issue, reduce the range of motion. Keep the arms lower, just a few inches from your sides, or do the movement one arm at a time. These arm circles move blood through the chest and shoulders, open up the small arteries, and help the upper body blood return to the heart. They also loosen tight muscles in the neck and chest that can restrict breathing and raise blood pressure. Think of it as a gentle flushing of the upper body circulation. Now we finish with 2 minutes of slow, deep breathing. This is the secret that calms the whole system. Sit comfortably, place one hand on your belly and one on your chest. Breathe in slowly through your nose to a count of 4. Feel your belly rise under your hand. Hold that breath for 1 second. Then exhale gently through your mouth for a count of 6. Repeat this cycle for 2 minutes. The longer, slow exhale activates your vagus nerve. That's the main nerve that tells your heart to slow down and your blood vessels to relax. Practicing this daily improves heart rate variability, reduces spikes of stress hormones, lowers blood pressure, and helps your arteries become less tense over time. If counting feels awkward, simply breathe in for 4, out for 6. Keep it slow and steady. If you're short on time, try 1 minute of breathing right after the marching. It still gives a big benefit. If you have mobility limits, do the entire sequence seated. Seated marching, 2 minutes. Seated arm circles, 1 minute. And the 2-minute breathing exercise. Safety notes: stop immediately and call emergency help if you experience new, crushing chest pain, sudden crushing pressure, jaw pain, or severe shortness of breath. If you feel lightheaded, sit down and rest. If you have known heart disease, recent procedures, or unstable angina, check with your cardiologist before starting any new routine. Progression plan. Start with this 5-minute sequence every morning for 2 weeks. After 2 weeks, if you feel comfortable, add 30 seconds to the marching and 15 seconds to the arm circles. In 4 to 6 weeks, you can increase walking speed slightly or add a second short session in the afternoon. Most seniors notice improved stamina, less breathlessness, and calmer pulse within a few weeks. Cardiovascular measures improve steadily after months. Why this routine works together. Marching engages large leg muscles and boosts venous return. Arm circles open the chest and improve upper body circulation. Breathing lowers sympathetic drive and enhances nitric oxide mediated vessel relaxation. Together, they reduce the strain on your heart, lower blood pressure, and make your heart less vulnerable to sudden events. Finally, pair this routine with the small daily habits we talked about earlier. Hydrate well, choose the heart-friendly foods, and don't delay scheduling recommended screenings. Do this daily, and you're building a protective layer around your heart, small actions that add up to major protection. A 2024 Cleveland Clinic report found that seniors who do light daily movement and breathing exercises cut their risk of a heart event by up to 48% in 1 year. So yes, even small actions protect your heart in big ways. Now let's answer some of the top questions seniors often have about heart attacks and these warning signs. Can I have a heart attack if I don't have chest pain? Yes. In fact, about 1 in 5 heart attacks are silent and go unnoticed according to the American Heart Association. What if my blood pressure and cholesterol are normal? Even with normal readings, hidden plaque buildup or stress can trigger heart strain. Regular checkups and ECG screenings help detect risk early. I live alone. What should I do if I suspect a heart issue? Keep a phone or medical alert device close and let a friend or neighbor know you're not feeling right. Acting fast can save your life. Now that you know the 3 silent signs of a heart attack, please don't ignore them. Your heart has been working for you every single day of your life, through stress, joy, and every moment in between. It deserves your attention and your care. If this video helped you understand your body a little better, tap that like button and share it with a friend or loved one. You might truly save a life, and it could be someone close to you. And before you go, I'd love to hear from you. Tell me in the comments, what worries you most about your heart health? Or is there another topic you want me to cover next? Your questions and stories inspire the videos we make here. So don't be shy, let's learn and grow stronger together. Because staying on your feet starts with keeping your heart strong. One small step, one small habit at a time.